Good morning. Good morning, everyone. I'm Danette R. Smith, and I'm the Chief Executive Officer of the Nebraska Department of Health and Human Services. Thank you so much for joining us this morning. Last fall, the voters of Nebraska passed Initiative 427, which directed Nebraska Department of Health and Human Services to submit a state plan amended to expand Medicaid by April 1st, 2019. Today, we will present those efforts. This morning, though, I'm very proud that I'm joined by my esteemed teammates, Director of Behavioral Health, Sherry Dawson, Director of Children and Family Services, Matthew Walden, Director of Developmental Disability Services, Courtney Miller, Interim Director of Public Health, Bo Botello, and then finally, Director of Medicaid and Long-Term Care, Dr. Matthew Van Patten, and his wonderful team, the Deputy Directors of Medicaid and Long-Term Care. Representatives from each of the divisions that comprise DHHS are here to highlight the fact that Medicaid expansion will be woven through each of the department's divisions. As you know, I joined the department at the end of February from Virginia Beach Department of Human Services. Upon my arrival, I had an opportunity to meet with the Nebraska Medicaid team to look at the scope of work for Medicaid expansion. And I have been totally impressed with their focus on our customers and their intentionality in delivering this expansion. On January 1st, 2019, the state of Virginia implemented Medicaid expansion. In my experience locally, it is critical that a monumental undertaking such as Medicaid expansion be customer-centric, be delivered in a deliberate and thoughtful manner. Here in Nebraska, it may appear that we need to move expeditiously to implement the expansion, but I can tell you from my experience, not only with Medicaid expansion, but having a long career in delivering human services, it is better for our fellow citizens that we carefully and methodically administer the expansion appropriately. The department is committed to ensuring Nebraska's Medicaid expansion is fully functional and viable on the first day of implementation. Our goal is to be prudent in developing a fully executed product that supports Nebraskans getting the best health care coverage possible. With this goal in mind, we will be launching the Heritage Health Adult Program on October 1st, 2020. With that, I'm going to turn it over to Dr. Matthew Van Patten, who will now review the paradigm and tenets of the Nebraska Medicaid Expansion Plan. Dr. Van Patten?
Thank you, CEO Smith, and welcome, everyone. Today we introduce the Heritage Health Adult Program. The state plan amendments that we are submitting to the federal government are the first step in this process of expanding Medicaid in Nebraska. What is submitted today is the culmination of months of research, planning, and assumption testing. We care that expansion is done right for Nebraska. Our approach has been to create a product for the market that delivers an exceptional experience. This morning I will go through the highlights of the Heritage Health Adult Program, and then my team will give an overview of the production schedule. The Heritage Health Adult Program is designed to effectively use managed care to encourage paths to wellness and life success while rewarding personal engagement and responsibility. This advances the objectives of the quadruple aim, which are to promote the beneficiary experience of care in terms of quality and satisfaction, to improve the provider experience of care in terms of quality and satisfaction, to improve the health of populations, and to reduce the per capita cost of health care. Initiative 427 requires Medicaid to be expanded to include adults ages 19 to 64 with an income up to 138% of the federal poverty level. This is an income of approximately $16,000 per year for an individual. All adults except certain populations such as pregnant women, persons with disabilities, and the elderly will be enrolled in the Heritage Health Adult Program. Each member's eligibility for this program will be redetermined every 6 months. The Heritage Health Adult Program will be a part of the existing Heritage Health Managed Care infrastructure. Heritage Health's Managed Care program integrates physical health, behavioral health, and pharmacy benefits into a comprehensive, coordinated program. There are 3 managed care organizations, or MCOs, that participate in Heritage Health. They are Nebraska Total Care, United Healthcare Community Plan of Nebraska, and WellCare of Nebraska. The state pays each MCO a per-member, per-month rate for each member enrolled. The MCOs, in turn, manage all care for their members. In designing a program for this new eligibility group, federal law has certain requirements. For example, 42 CFR Subpart C requires Medicaid expansions to be benchmarked to traditional commercial insurance, such as the insurance many people receive through employment. Our benchmark is modeled after the Blue Cross Blue Shield Pride Plan, one of the largest small group plans in Nebraska. In order to provide the benefit package to this new eligibility group, Nebraska intends to seek 1115 Demonstration Waiver authority from the federal government. This waiver authority will allow us to ensure benefits are delivered in the best way for Nebraska. Specifically, Nebraska Medicaid intends to create an innovative benefit structure that incentivizes wellness and life success by utilizing the full constructs of managed care and maximizing the value of the services we purchase. The Heritage Health Adult Program will have 2 tiers, Basic and Prime. At the launch of the Heritage Health Adult Program, all members will receive basic coverage. To earn Prime coverage, which provides members additional benefits such as vision, dental, and over-the-counter medications, members must participate in active care and case management, select a primary care provider, and attend an annual checkup. Our objective for the program's first year is to address the health needs of our new members as quickly as possible. In order to simplify billing for providers and reduce strain on our outdated claim system, members' eligibility will begin the first day of the month of application. When cost-effective, Heritage Health Adult Program members who have private insurance available, such as through employment, will have their insurance premiums paid through the Health Insurance Premium Payment Program, where Medicaid becomes the secondary insurer. Additionally, in an effort to promote healthy behaviors and personal responsibility, members in the new adult group will receive basic coverage for 1 year if they voluntarily drop commercial coverage for Medicaid. Members will also receive basic coverage for 1 year if they miss 3 or more appointments without notifying the provider during a single enrollment period. Moving into the second year and beyond, as a component of personal responsibility, members will need to meet certain community engagement requirements to retain Prime coverage. Members will either need to be caring for a relative, be volunteering for a public charity, be attending a post-secondary school or apprenticeship, be employed, or be involved with job-seeking activities for at least 80 hours per month. Members who do not meet these requirements at their eligibility redetermination will receive basic coverage. Designing the program in this way encourages paths to wellness and life success by rewarding personal responsibility. At this time, my deputy directors, Thomas Rocky Thompson, Heather Lashinsky, Dr. Laura Peterson, Karen Hang, and Jeremy Brunson will give you an overview of the production schedule. I now invite Rocky Thompson, Deputy Director of Policy and Communication, to discuss the first aspects of the production schedule, the filing of the state plan amendments. Mr. Thompson.
Thank you, Director Van Patten. Today, the department will be submitting 3 groupings of state plan amendments, or SPAs, to implement the Heritage Health Adult Program. The 3 groupings concern eligibility, financing, and benefits. The submission of the SPAs will begin the 90-day process with the federal government to approve the SPAs that constitute our expanded Medicaid program. It is important to note that this process can be paused by the federal government. if there are questions about the spas. Once the state responds to those questions, a new 90-day process begins, and the federal government will continue to make a determination. In addition, there will be changes to the managed care waiver to account for the new eligibility group, and we will be reviewing the state's home and community-based waivers for any changes needed to accommodate the new adult group as well. As discussed, the state will also be seeking a new Section 1115 Demonstration Waiver for some of the more innovative reforms in the proposal, like the tiers based upon wellness and life success. In addition to submitting the SPAs today, we are also submitting a concept paper to CMS on the 1115 waiver. The Section 1115 waiver process is long and requires extensive negotiations with the federal government and public outreach. We must have at least 2 public hearings prior to the submission of the waiver. Now I'd like to invite Heather Lashinsky, Deputy Director for Delivery Systems, to discuss the amendments that will be made to the division's contracts with the managed care organizations.
Thank you, Rocky. Good morning, everyone. As mentioned, my name is Heather Lashinsky, and I'm the Deputy Director for Delivery Systems. Today, I'm going to address the contract amendments that will be needed to implement the Heritage Health Adult Program. Our contracts with the Heritage Health Plans, the Dental Benefits Manager, and the Enrollment Broker must be amended to specify business requirements we will expect. These requirements will include, but are not limited to, adequacy of provider networks, active care and case management, efforts to promote wellness and life successes, and better access to care. Additionally, we will develop operational goals and quality metrics to ensure the health plans are supporting the new population in incentivizing and rewarding engagement in healthy behaviors. Furthermore, the plan management staff will conduct rigorous readiness reviews to ensure the health plans have the operational requirements, policies and procedures, and processes in place to ensure they can enroll and manage the new population. A consideration in the expansion implementation is the time in which it takes our federal partners at CMS to approve the contract amendments, which will include the capitation rates for the new population. It is reasonable to expect that the approval process will involve ongoing discussion with our federal partners, which will take some time. CMS must approve the payment rate that is made to the health plans in the form of the capitation payment before the department can begin paying these rates. Now I'd like to invite Dr. Laura Peterson to walk you through the technology requirements and changes that will be necessary.
Thank you, Heather. I'm Dr. Laura Peterson, Deputy Director for Healthcare Informatics and Business Integration. A well-functioning Heritage Health adult program requires the division to update a variety of our business technologies, including our eligibility and claims systems, Access Nebraska website, and voice response system. Providing a robust and positive member experience necessitates modifying these interfaces as well with our Heritage Health managed care partners and our internal business technologies. The state will likely face some challenges during the update process. Our aging technology with limited automation means we will have to supplement with significant manual processing. This requires more staff and resources competing for the same pool of resources for other projects in our existing beneficiary pool. Further, our timeline is shortened for change, as there is uncertainty to the specific requirements that will limit project scoping until CMS approves the SPA. Last, a low but potential risk is destabilizing our existing business system by making updates while using the same system for our current beneficiaries' claims or eligibility processing. In order to mitigate these risks, we're making only moderate modifications to the existing business systems and claims modules, contracting with a vendor for community engagement tracking, leveraging our partnerships with the Heritage Health plans, creating a manageable timeline, and utilizing project management sound techniques. Finally, a major factor in successfully implementing and maintaining the Heritage Health Adult Program is solid field operations. Karen Hang will now take you through the plan for field operations.
Thank you, Dr. Peterson. I am Karen Hang, Deputy Director for Eligibility. Nebraskans will utilize Access Nebraska to apply for adult Medicaid. Applications can be submitted electronically through the website or by telephone through the customer service centers, or by utilizing a paper application sent through the mail. Customer service will be available in over 50 local office locations, as well as via the telephone through customer service centers. The operational goals for this new program are twofold. One is to provide a high-quality customer experience and keep call wait time at our customer service centers to an average of 5 minutes or less. The other goal is to provide eligibility determinations that are timely and accurate. The operational target is for the average days to process applications to be 20 days or less. The target accuracy rate is 95% or better. It is estimated that the application volume for the Heritage Health Adult Program initially will be 7,000 applications a month. In order to accommodate this large volume, we will start processing applications 2 months prior to the October 1st, 2020 start. The eligibility process will take an average of 30 minutes per application. Nebraskans determined eligible will continue to access eligibility operations case managers to report changes in circumstance and for the eligibility renewal process. DHHS case managers will also provide additional support to the eligible population to increase financial stability. For those classified as medically frail, this support will be around disability income sources and other programs to increase independence. For others, we will work with the SNAP Next Step, formerly known as the SNAP Department of Labor Reemployment Pilot Program, on the career path to increase financial stability. Eligibility operations averages 2 hours a year case management per member support. In order to successfully operate this program, 66 additional teammates will be needed. Now I'd like to invite Jeremy Brunson to discuss the financial aspects of the Heritage Health Adult Program.
Thank you, Karen, and good morning. Again, I am Jeremy Brunson. I am the Deputy Director for Finance and Program Integrity. My team will be working on the processes associated with paying for the benefits that will be provided within the new Heritage Health Adult Program. First, we will execute a contract amendment with our actuary to add a scope of work to create new categories of aid specific to the Heritage Health adults, through which Nebraska Medicaid will pay capitated payments to the Heritage Health plans for the new populations and benefit packages. After executing the contract amendments, we'll begin our work on the development of the capitation rates for the new categories of aid. Based on our experience with creating actuarially sound rates for a new category of aid, we anticipate this process to take approximately 3 to 4 months. These rates will not only be submitted to CMS for approval as part of the Heritage Health Plan contract amendments, but they will also be a key component of the financial sections of the 1915B waiver amendment and the budget neutrality calculation for the 1115 Demonstration Waiver. Last, Nebraska Medicaid intends to implement a time-limited risk corridor for the Heritage Health Adult Program to mitigate any unforeseen risk to both the Heritage Health plans and state Medicaid program. While we've already engaged in an analysis to prepare a well-researched and reasonable cost estimate for the new expansion groups, implementing a risk corridor has been identified as a best practice in other states that have already expanded. And it's consistent with our own practice in Nebraska, as we implemented Heritage Health in 2017 with a risk corridor for similar risk mitigation purposes. This concludes my remarks, and I would like to welcome Mr. Rocky Thompson back to take you through the regulatory and legislative updates.
Thank you, Mr. Brunson. To cover the new adult group, state regulations will also have to be updated. This includes changes to Titles 471, 477, and 482. The regulatory process will require at least one public hearing and approval from the Attorney General's office. In terms of legislation, we are currently monitoring legislative action which might impact the Heritage Health Adult Program and its implementation. This includes the final appropriations bill, any bills changing the services provided under Nebraska Medicaid, and any bills concerning the payer delivery system. With that, I'd like to invite back Director Van Patten to the lectern for some final remarks.
Thank you, Rocky. Before we take questions, I want to thank the following groups and organizations for their input. The Area Agencies on Aging, CMS, the Foundation for Government Accountability, the Health Center Association of Nebraska, members of the Nebraska Legislature, National Association of Medicaid Directors, specifically members from Connecticut, Idaho, Louisiana, Montana, Utah, and Virginia, Nebraska AARP, Nebraska Academy of Family Physicians, Nebraska Appleseed, Nebraska Association of Behavioral Health Organizations, Nebraska Chiropractic Association, Nebraska Department of Insurance, Nebraska Hospital Association, the Managed Care Organizations, Nebraska Total Care, United Healthcare, and WellCare. I would also like to thank the Governor, Lieutenant Governor, CEO Smith, and my teammates in our other DHHS divisions for their support in this process. Finally, thank you to my team at Nebraska Medicaid who have put in tremendous effort over the last 5 months to develop a plan that promotes the quadruple aim, creates pathways to wellness and life success while incentivizing and rewarding engagement in healthy behaviors. We have a great deal of work ahead of us, but are in a strong position to successfully implement the Heritage Health Adult Program on October 1st, 2020. We have covered a great deal of information today. Matt and Julie have paper copies of the slides for you. We will take your questions now, and you can contact Julie and Matt if you have more questions after we conclude. You can also visit our website at www.dhhs.medicaidexpansionquestions@nebraska.gov, where we will make available our state plan amendments, concept paper, and slides today at 1:00 p.m. Thank you. This now concludes our remarks.